Thank you all for joining us as we put on this webinar about our new funding opportunity, Amplifying Health Advocacy. I am Jahan Benton Clark, one of the portfolio directors here at the Foundation, and I'm joined by my colleague,
Kyle Legleiter, Senior Director of Policy and Advocacy.
First, we just like to go over what we're going to discuss on this webinar today. So first, we want to give you all an introduction to who the Colorado Health Foundation is, talk a little bit about our approach to policy advocacy, give an overview of our funding opportunity that will be available for 4 deadlines, talk about the types of advocacy that we seek to support along with our funding criteria, discuss a little bit about our other open funding opportunity, which is around rapid response funding, do a little bit of myth busting through our frequently asked questions, discuss how to apply, and share some additional resources.
If you found your way to this webinar, hopefully you already know a little bit about the Colorado Health Foundation, but we wanted to introduce ourselves just in case. At the Colorado Health Foundation, we have a vision that across Colorado, each of us can say we have all that we need to live healthy lives. This is our vision because we believe that health is a basic human right, and that means that Jahan and I and all of our colleagues at the Colorado Health Foundation come to work every day with a mission of improving the health of Coloradans. We know that we can't do that alone at the Colorado Health Foundation, so that's why we also have a rally cry of bringing health in reach for all Coloradans, because we know that we need partners to join with us in this effort to improve the health of Coloradans. At the Colorado Health Foundation, we talk a lot about how health equity and bringing health within reach is at the heart of everything that we do. So we wanted to talk also about how we define health equity and what we think that that means. We believe that having health equity is about having all we need to live healthy lives, and that health equity exists when there are no necessary, avoidable, unfair, unjust, or systematically caused differences in health status. As part of the focus areas that the Foundation has in our overall strategy as a foundation, we've adopted cornerstones that are really bedrock features of everything that we do ourselves at the Colorado Health Foundation and our expectations of all the partners that we work with in our work. One of our cornerstones is that we serve Coloradans who have low income and or have historically had less power or privilege. We also have a cornerstone that we are informed by the community and those that we exist to serve in everything that we do. And finally, we do everything with the intent of creating health equity. Each of those cornerstones are important for all of the focus areas, which outline the topics that the Foundation is focusing on as part of our strategy for bringing health in reach for all Coloradans. Those 4 focus areas are maintaining healthy bodies, nurturing healthy minds, strengthening community health, and championing health equity. Today on this webinar, as we talk about this funding opportunity, we're going to talk in particular about the Champion Health Equity focus area of the Foundation.
So within our Champion Health Equity focus area, we have 2 priorities, one of which is capacity building and one that is around advocacy. With our advocacy work, we are really concerned with supporting a continuum of advocacy that advances policies reflecting Coloradans' health priorities so that Coloradans' interests and priorities are front and center in shaping policy decisions that impact health. The Foundation has been engaged in policy advocacy work for quite a while, but we have never had advocacy as a specific priority of the Foundation. So how do we think advocacy can really help us create and contribute to health equity across the state of Colorado? Well, we really believe that the actions of local, state, and federal governments can really have a significant impact on whether or not health is in reach for all Coloradans. We know that decisions are made around public sector spending, regulatory authority that our local, state, and federal governments have, and also really thinking about the convening power and also the bully pulpit that folks have as it relates to advocacy. And that through advocacy, we can really shape what the public sector does and really think about how we influence them and use resources across the state of Colorado.
One of the things that we want to unpack in this webinar is a very broad definition of advocacy and everything that we think of at the Colorado Health Foundation that can fit under that umbrella. Oftentimes people think that advocacy only exists when you have a specific policy solution that you're fighting for, but we tend to think about advocacy more broadly. At the top of this chart, you'll see something that's really important to us, which is listening to community to really identify and listen for their perspectives about what are the issues in their lives that are limiting health equity and putting health out of reach for communities, for families, for individuals in the state of Colorado. So for us, when we think about advocacy, it really starts with all of the community engagement that we do at the Colorado Health Foundation and that we expect from our partners too, that they are really keeping their eyes and ears on the ground in Colorado and soliciting those ideas and perspectives about what is limiting health equity in our state. If you do that, you'll hear about lots and lots of great assets across the state of Colorado, great things that we have to build off of as a state to help bring health in reach for people. But you also hear a lot of challenges that we have as a state as well, and opportunities for us to bring health closer in reach, particularly for those who have low incomes or less power and privilege. Sometimes in those conversations on the issues that we hear about where the state could be doing even better, policy change or the government, whether it's your local government, state government, federal government, doing something differently could make a difference for families and for their lives. That could sometimes be part of the solution, but that's not always part of the solution. In the cases where it is, that gets you further on this continuum of advocacy that we think about. If you've listened broadly across communities and heard about issues that are important to them and a potential role for government to do something differently, you may have consensus that something's a problem or that something could be different or could be better, but lots of differing perspectives and opinions about what could be done differently to make that situation better in our communities in Colorado. And that's what that third bubble on this chart is about, is really soliciting and engaging folks from the community in different perspectives to really develop and identify what would be a policy solution, something that your local government, your state government, the federal government could do differently to help to contribute to health equity in Colorado. And there's a lot of hard work to go along with that process to really reconcile and get to good solutions there. If you've done your homework on that, then that brings you to the thing that people tend to think about most when they think about advocacy, which is we have a solution that we're fighting for. And there's a lot of work to be done in that bubble for sure, from figuring out who is it that could be the decision maker about that particular policy change. Is it the state legislature? Is it a local body? Is it the federal government? Is it through the judicial branch of government? Is it through the executive or the legislative branch? There's lots of work to be done there, even when you have a solution in mind, of fighting for that solution and convincing policymakers that they have the opportunity to do something to make our communities better. If you're successful with that, the work doesn't always stop there. So even if you are successful in changing a policy or convincing a policymaker to do something differently and all that, there's oftentimes a lot of work that follows on with that to actually implement that policy, because it often involves government institutions or other partners in communities starting to behave differently or adopt different practices and ways of doing business and all that too. And there's lots of work to be done along with just helping along with the implementation and making sure that a new policy is actually bearing fruit into different behavior and different institutional actions in communities and all that. And then finally, even if the behaviors of government are starting to shift and all that, it's important to continue to engage and listen with communities to really evaluate the impact that any policy change might have, to really understand, did this policy change actually produce an impact on creating health equity, putting health in reach for more people in our communities, or did it only solve part of the problem and we need to continue to do more work to get at the remaining parts of the problem as well. So advocacy does have a very broad definition in terms of what we do in our advocacy work at the Colorado Health Foundation, and also in terms of what we are open to working with partners about and supporting in advocacy organizations as they're thinking about opportunities to bring health within reach for Coloradans.
Given the broad definition of advocacy, when we started to explore where we thought the Colorado Health Foundation could contribute to creating health equity across the state, we really saw that we could play a role in helping to support and create a stronger and more interconnected ecosystem of advocates through providing flexible general operating support, technical assistance, and working with our grantees to develop convenings and opportunities for network building. As we've thought further about this funding opportunity, we wanted to share with you some typical amounts of funding. So we expect that our grants will range for the next 2 to 3 years from $50,000 to $200,000 annually, but ask organizations to apply for what they believe it will take to move their advocacy efforts forward. We will have 4 deadlines: October 15th, 2018, June 15th, 2019, October 15th, 2019, and June 15th, 2020. As a part of this funding opportunity, we are interested in supporting advocacy efforts that address one or more of the following priorities of the Foundation: primary care, children move more, early childhood social emotional development, teen young adult resiliency, adult recovery, food access and security, and affordable housing. Again, the Foundation's advocacy efforts have to be in one or more of these 7 priorities. So we are really interested, as you heard us talk about the broad definition of advocacy, work that happens across all levels of government, at the local, state, and federal level, as well as across all branches of government, legislative, executive, and judicial branches. And we ask that organizations speak to what levels of government and branches of government their advocacy tactics are focused on. Continuing with this broad theme of advocacy, we wanted to share with you a few examples of tactics for funding that we will support. But this is not a limited list. It's just a couple of examples we want to give you all. Feel free to share with us the tactics that you are interested in utilizing. So, coalition building, management, and facilitation, community organizing, base building, and mobilization, issue education, framing, and communications, work around media advocacy, policy and legal analysis, tactics around policymaker education and accountability, public education, regulatory advocacy, and voter engagement. Again, this is just an example of a few types of advocacy tactics that we are interested in supporting, but we want to hear from you what are those tactics that your organization is best positioned to carry out. So as we think about what the criteria is for this funding opportunity, we are really looking for organizations that are aligning with the Foundation around either promoting a public policy solution, protecting an existing solution, improving or supporting implementation, or building political will to support policies. Again, any of these 4 funding criteria will be considered. Additional features that we are looking for in relation to the Amplifying Health Advocacy funding opportunity is for organizations to be able to describe to us alignment with the Foundation in terms of how the proposed work advances the Foundation's cornerstones you heard Kyle and I address earlier, as well as advances our mission to really improve the health of all Coloradans. We are interested in projects that are focused on advocacy, and as such, projects that provide direct services will not be given consideration through this particular funding opportunity. We are interested in hearing from organizations how what they are proposing is specifically related to public policies at the local, state, and/or federal level. We are also interested in really understanding how the proposed activities reflect the interest of community members most impacted by health inequities, and ask organizations to really talk with us about how they are supported by the community and have considered the community's needs and wants in their proposed activities. We are also interested in really understanding the intended impact of the work on the public policy at the local, state, and or federal level, and we'll be looking for that throughout the applications and within our site visits. The last thing that we are really interested in understanding is why your organization believes that you are the right group to conduct this type of proposed advocacy work. So really thinking about your understanding of the issue, your connection to that issue, your expertise around a particular issue or population, and really understanding of advocacy at different levels.
We also want to take a moment on this webinar to talk about another type of advocacy support that's available to organizations from the Colorado Health Foundation, in addition to the Amplifying Health Advocacy funding opportunity. And this is our rapid response advocacy funding. There are some key differences between these two types of funding, and so we want to make sure that folks know about both opportunities. One of the differences between these two types of funding from the foundation is when you can apply to us for grants. For the funding opportunity, it's limited to specific grant deadlines that we mentioned above. But for rapid response funding, there actually is no deadline, and you can apply to us at any time when your organization is ready to submit an application. One of the other differences is the time that it takes us to respond to your application for a grant request between rapid response and the funding opportunity. With our funding opportunity, a review of your grant application and response back to you typically occurs within 4 months. But for rapid response applications, we typically get back to organizations within 30 days of them submitting an application to us. One of the reasons for this difference is that these two types of funding support different types of work. The funding opportunity that we've been talking about in depth on this webinar is really intended to support longer-term, forward-thinking capacity building for organizations and to give them flexible funding to work over the long term towards whatever goals or strategies make sense for the mission of that organization. The rapid response funding is really limited to time-sensitive opportunities for advocacy. They're either proactive in nature, so there's an advocacy window of opportunity that may not be gone somewhat quickly that you want to capitalize on, or there could be a threat on the policy horizon that you didn't see coming, but you might need some additional resources to be able to mobilize and respond to that policy threat. So rapid response grants are for specific project grants, and they are time-sensitive in nature. One of the things that's similar across these two types of funding is that both the funding opportunity and rapid response allow for flexibility for the applicant organizations in terms of the specific activities and tactics that they might use the funding to do. Basically, you're able to use this funding to do any type of activity that's legally permissible for a 501c3 organization to do, and we'll talk in a moment a little bit more depth about what those types of activities are. Finally, one other distinction between rapid response and the funding opportunity grants is the length of the grant term. For the funding opportunity, grant terms will be up to 3 years worth of work for an organization. For rapid response, because they are in service of specific projects that are time sensitive in nature, there's a maximum of 9 months in terms of the grant period for rapid response grants. You can find much more information about our rapid response funding opportunity, including how to apply and what the much shorter application for those grants looks like, on the Colorado Health Foundation's website.
So earlier in the webinar, we said we were going to do a little myth busting and also answer some frequently asked questions. So Kyle, we've heard a lot from different organizations about how do we define health equity. What would you say to that?
I go back to the definition that we shared at the beginning of this webinar, that health equity exists when we all have what we need to live healthy lives. So part of the reason why we've made health equity at the heart of all of the work that we do at the Colorado Health Foundation and the work that we expect of our partners is that we've heard from communities and families across the state of Colorado that health is not currently in reach for everybody in our state, and that's something that we want to change. So we think health equity exists when that story will look different for Colorado, that everybody in Colorado can say, we have what we need to live healthy lives.
So another question that we've heard a lot is, the foundation has these new cornerstones. What are cornerstones? And how are you all applying them to this funding opportunity?
We realize that cornerstones might be a little bit unusual in the world and that not every organization talks about their work in these terms. So it's a good question. As I said, cornerstones are really bedrock principles that we hold ourselves accountable to. So they're gut checks for us as we think about the work that we're doing ourselves, of are we actually walking the talk on putting health equity at the heart of everything that we do, having community inform everything that we do, and being absolutely clear that we exist to serve Coloradans who have low income and or historically have had less power and privilege. So those are questions and gut checks that we apply to ourselves all the time. And as we mentioned, we're also applying these cornerstones to all the partners that we support along the way in making Colorado a place where health equity exists for all of us.
So, as one of those cornerstones is being informed by the community, what does that mean, and what does that mean for us as we are applying for foundation funding?
So it means, as we mentioned in that broad definition of advocacy, that listening to the community is at the heart of everything that we do, and that's something that we look for in applicants and partners for funding from us. So we ask questions about, how do you get information from outside your organization about what needs are in communities, what opportunities for government and policy change to make life better in Colorado, to bring health more in reach for more people in our state. So we're looking for systems, processes, practices that you might have as an organization about gathering input and perspective and genuinely listening in open-ended and broad ways to the perspectives of people beyond just your own staff and board and volunteers in your organization, but really thinking through how are you creating a holistic picture about what health in our state looks like and what types of policy change or types of advocacy can help to bring health in reach for more people in our state.
So, a few other questions that we get specifically related to the application and review process, Kyle, are around if an organization has to advocate for all of the foundation's priority areas in order to be eligible to apply.
So when we say priority areas in this case, we're referring to that slide where we had 7 topics. They're important to the foundation's focus areas in our strategy for bringing health in reach for all Coloradans. Those included things like primary care, adult recovery, children move more, affordable housing, so a broad spectrum of different types of topics that we at the foundation are interested in. We've chosen to make all of those priorities part of our work, but we don't expect that organizations that are applying for this funding opportunity have to be doing work related to all of those topics. What we ask you to think about and to write about in your application is the mission of your organization and which ones, and it could be more than one, but it doesn't have to be more than one, can you see your organization likely to be doing policy work related to during the grant period?
As we've described the Amplifying Health Advocacy funding opportunity, we have shared with folks that this is really intended to apply broad, flexible, general operating support. And so we've gotten a couple questions about how do you write a grant application towards general operating support? What is a general operating support grant, Kyle?
So a general operating grant is a flexible pool of funding from our foundation to your organization that really allows your organization to decide what is the best use of that funding and how can you make the most out of those resources to advocate for policy changes that would help to bring health in reach for more people in Colorado. There are no specific requirements about what you do or do not do with that funding, so it is, again, up to the organization how they deploy those resources in service of furthering their mission. So when you write a grant application for a general operating grant, we encourage organizations to think about it not as introducing a project or a specific initiative that your organization wants to take on, but really introducing your organization to us through your grant application. So certainly talk about the mission of your organization and also how advocacy work fits into the broader picture of your organization. What types of advocacy work do you tend to do most often? Is it work related to federal advocacy or advocacy at the state or the local level or a mix thereof? Do you tend to specialize and have a lot of expertise in certain types of advocacy tactics? So if you think back to that slide that we showed earlier that was just a list of illustrative examples that was not exhaustive about the types of advocacy work that an organization might do. We certainly don't expect that any one organization needs to do every type of advocacy tactic or be good at everything, but tell us a little bit about the types of advocacy work that you tend to do most often now, and if you have aspirations about developing strength and capacity and new tricks over the grant period, if there are ways that you would like to grow as an organization that this flexible funding might be able to support. But generally, that's what we're looking for. Tell us about the mission of your organization, the type of advocacy work that you tend to do the most often, and that's what we would like to hear in your grant application. Jahan, what are our grant review criteria for this funding opportunity, and really what are we looking for when folks apply under this funding opportunity?
Definitely. As Kyle just shared with you all how we are thinking about you writing your grant application for general operating support, it's exactly what we are looking for as we've shared the features that you should include in that application. We're really looking at work that is proposed to promote a public policy solution or protect an existing policy, to improve or support implementation of a policy, or to really build political will. And as we understand how organizations are attempting to do that through a variety of tactics aimed at different levels and branches of government, we're really looking for alignment with the foundation. So how does this work really advance health equity across Colorado, and again address one or more of those 7 topical priority areas that I mentioned earlier? We're also interested in if it is really an advocacy tactic that is being proposed for this work, and what the intended impact might be of the proposed advocacy tactics. We're interested in understanding why organizations are the right organizations to do the work, and their understanding of what the landscape looks like around a particular issue and an approach to advocacy. We're also interested in how organizations have engaged with the community as they have thought about the advocacy work that they would like to engage in. As a part of this process, we think that these 4 grant cycles will be very competitive, and our goal is to really have a diverse portfolio of work that we are supporting across the state of Colorado, aimed at really amplifying health advocacy and really building a strong ecosystem of advocates.
Jahan, if an organization applies under this funding opportunity, who will their application be assigned to within the foundation?
I think most of you know that a couple of years ago the foundation restructured, and that our program officers now are assigned to both a geographic area as well as one or more of the foundation's priority areas. And so, to the best of our ability, we try to align the work that is being proposed with the area that those organizations cover to assign our program officers. However, given existing relationships or the size of organizations, sometimes we are unable to do that because our organizations cover multiple issues in multiple geographic regions. But we do take into account existing relationships, areas of focus across the state, and we'll do that as we are trying to strive for organizations not to have more than one program officers when possible.
Jahan, if an organization receives a grant through this funding opportunity, what activities will be required of them?
So as we've really thought about how to strengthen an ecosystem and how the foundation can contribute to that work across the state, we have thought about convenings that we want to co-develop in partnership with our grantees, and also evaluation activities that we also want to co-develop with our grantees. So we think that the evaluation work should take no more than a few hours over the course of each year, and that we would do a minimum of 2 convenings, but we'll really be, again, working with grantees around what the topics of interest will be and trainings during those convenings.
Jahan, if an organization applies through this funding opportunity, can they also apply for a rapid response grant from the foundation?
Of course. The Amplifying Health Advocacy funding opportunity does not preclude any organization that feels that they have a time-sensitive issue and potential response from applying through our rolling rapid response grant application process. Please feel free, if you have questions, to reach out to any of our staff members to talk through what that rapid response idea might be. So Kyle, we get a lot of questions about legal considerations. And so could you share with our webinar audience what types of advocacy activities are 501c3 organizations legally permitted to do?
That's actually a really great question, and one that we're always happy to get and to provide resources for. So in a moment, we'll share some resources and some links with the audience of the webinar that digs into the details of this question in particular. But long story short, 501c3 organizations are tax exempt under the IRS, and in exchange for having that preferential tax treatment, there are a few restrictions in terms of the types of activities that 501c3 organizations are legally permitted to do when it comes to advocacy work and political work that an organization might want to do in furtherance of its mission. These types of restrictions come to play most often with advocacy that relates to the legislative branch of government, or with ballot measures, or with political activities, or engaging candidates for office. So we'll be sharing some resources in just a moment that speak specifically to what 501c3 organizations can and cannot do in those domains. But the overall message that we'd like to share with the audience is there is a wide range of legally permissible advocacy activities that 501c3 organizations are allowed to do. It's never a stupid question to ask, can I do this, or is it legally permitted for me to do this? Because there actually is a lot that organizations can do.
Great. Can you talk a little bit as well about whether or not our funds can be used for lobbying, and whether we will fund organizations that lobby?
Yeah, so we get this question a lot at the Colorado Health Foundation because 501c3 organizations are legally permitted to engage in some lobbying. It can't be the majority or the preponderance of what that organization does. So you need to be doing things in addition to lobbying as part of your work. But it is absolutely legally permissible for 501c3 organizations to do lobbying, provided you have funding that allows you to do it. When we talked about the funding that's available through this funding opportunity, these are general operating grants. And so that means that the only restriction on the funding that you would receive from the Colorado Health Foundation, both through the funding opportunity for Amplifying Health Advocacy and also for project grants through our Rapid Response funding opportunity, the only restriction that we put on that is you need to limit yourself to the same restrictions that you have by virtue of your tax status of being a 501c3 organization. However, we do not require you to lobby with your funds from the Colorado Health Foundation. It is up to you to decide if you would like to do that. If your organization decides that you would like to engage in lobbying, you are able to use funding from the Colorado Health Foundation to support that work. But we do not earmark funding for lobbying or require you to lobby as part of your grant agreement with us. It truly is the decision of your organization as you think about the mission that you have, the goals that you have, and what strategies would be effective at moving those goals forward, whether or not lobbying is part of what you might need to do as an organization. But we do not require you to do that. We do not earmark funding for you to lobby, but you are able to do that if you choose to do so.
Another question that we get often is whether or not Colorado Health Foundation funds can be used for partisan political activities.
So when we mentioned that your funding from the Colorado Health Foundation is restricted to activities that are legally permitted to 501c3 organizations, partisan political activities are one of those very few types of activities that are not legally permitted for 501c3 organizations to engage in. So these are things like making direct candidate contributions, supporting the goals or objectives of one particular political party and all that. So you cannot use Colorado Health Foundation funds to engage in those kinds of activities. If you have more questions about legal considerations related to advocacy work that your organization may be thinking about doing, we wanted to direct you to a couple of resources that might help you to think through what tactics might make sense for your organization and what you can and cannot do as a 501c3 organization. The first of these resources is a series of training workshops that the Colorado Health Foundation sponsored, looking at particular types of advocacy work and doing some myth busting and about what the legal parameters are around those types of advocacy activities. So they cover topics like ballot measure engagement, engaging candidates for office, lobbying, and many other topics. So included in this Advocating for Impact page on the Colorado Health Foundation website, you'll hear recorded webinars of all of those training opportunities that we recorded previously, as well as links and resources that explain the legal parameters around that type of advocacy work. So what can you and can you not do as a 501c3 organization, as well as perspectives from organizations that do that kind of work about why they decided that it might be important for them to engage in that kind of advocacy, given what their mission and their goals as an organization are, and how to do that type of advocacy work well. The other resource that we put up on this page was to a compendium of resources online under the Boulder Advocacy website. This is a organization that has lots of legal experts with expertise in this niche area of tax law about advocacy activities of nonprofit organizations. And it's a wealth of information both about general guidance about what you can do as a 501c3 organization, and then also if you want to go deep into the weeds about specific types of advocacy work that you might be considering doing. It's a wonderful resource to get some of your questions answered, so we encourage you to check that page out.
So now on to the fun part. So how do we apply for funding? So first you will need to go to www.coloradohealth.org. You can click on the right-hand top corner to the open funding section of the website, and then you will see this funding opportunity available for you to apply to. All organizations, if you are not already registered within our grants management system, will need to complete a registration in that system, and then you will be allowed access into our online application. The form can be saved. It does not have to be completed in one full sitting, but you should go ahead and start thinking about what are all the materials that you need to have available in order to complete this application form in responding to this general operating support grant. On our website, we have detailed instructions for how to go through the application process, and ask everyone to please take time to read through those instructions, and feel free to contact us if you have questions.
We hope that this webinar today was helpful in giving you some background about the Amplifying Health Advocacy Funding opportunity. Hopefully it answered some of your questions. If we did not answer all of your questions, we're always happy to talk to you. So you'll see my contact information and Jahan's contact information on this slide, and we encourage you to be in touch with any questions that you have for us.
Thank you for your time.